Hello, everyone. Welcome to Medtalks channel with Dr. Syed Raza. My name is Dr. Golsa, and today I'm talking to Dr. Syed Raza about a very common health condition, like talking about hypertension. And hello,
Hi, Dr. Golsa. Nice to be here.
good evening. How are you?
I'm fine. Thank you so much. A very good evening to you.
Thank you so much. So today we're going to talk about hypertension, right?
Yes, correct.
Okay. My first question is just like, how common is hypertension?
Right. Hypertension is very common. And if I just give you some figures, the global prevalence is 1.28 billion. So that means all across the globe, 1.28 billion people are suffering from hypertension. Now,
Wow, okay.
unfortunately, the unfortunate fact is that a majority of them, they do not know that they have hypertension.
Yeah,
And when
true.
I say about prevalence, you'll be surprised that one in three individuals worldwide, they are suffering from hypertension. And if you take the figures from the United States, where the figures are more up to date, one in two individuals are suffering from hypertension. So globally, it is a very prevalent condition, a very common condition. And as I
Okay,
said, half
so,
of them do not know that they have got high blood pressure.
and if they don't know, like they're not doing a checkup or everything, how they should know? Like they should wait till have a very serious condition, or they need to like regularly check up their hypertension.
Yeah, I think that's very important that the patients they need to get their blood pressure checked from time to time. Why people are not diagnosed? Because they do not get their blood pressure checked. And why
True.
they do not get their blood pressure checked? Because they do not have any symptoms. So it is called a symptomless disease. It's a silent disease. And also it has
Yeah.
also been called a silent killer for the same reason.
That's true. So, like, how often do you recommend for general public, for a healthy person that they're not feeling any symptoms and they don't have any other medical condition to check their blood pressure?
Sure. See, the blood pressure should be checked even in younger individuals. And when I say younger individuals, I'm not talking about young kids, but as they get to say even in their 20s,
Adults. Mm,
yeah, then yeah, 30s, 40s, yeah, correct. Adults, I would say, yes. But children also they have got high blood pressure, but it is rare. So mainly it is the adults above the age of 18. We should routinely check blood pressure. It becomes even more common as an individual gets above the age of 40, because as you age, the incidence and prevalence of blood pressure does increase.
okay. And when they check, what should be the number that they understand? They need to understand that they need to go to a medical professional or specialist for like navigating this problem. What should be the number?
Sure. Now, this is very debatable question that you have asked because the numbers they vary from region to region. So if you take the European standards and if you take the American standards, they are different. Now, since I personally follow the European standards, the guidelines, then I would just give you that number first. So, if because the blood pressure has got two figures, there is a systolic, the upper number, and then there's a lower number which is called diastolic. Okay,
Mhm.
and the upper one, the cutoff is 140 millimeter of mercury, and the lower one is 90 millimeters of mercury. That is the threshold. If the blood pressure is above this, then someone may be considered or labeled as hypertensive. Now, going by the other guidelines, which are from US, which is American guidelines, so they've got a different cutoff. If you have anything less than 120 by 80, then you are normotensive. Your blood pressure is considered to be normal. If it goes between 120 and 30, then it is elevated blood pressure. And if it goes above 130 by 40, then you are in the zone of class 1 or stage 1 hypertension, and above that you're in stage 2 hypertension. So it is a little bit complicated to understand, but by and large the guidelines, even the WHO says your blood pressure, if it is more than 140 by 90 millimeters of mercury, then you should be considered hypertensive. So it's a little bit
So
complicated, I would
above
say.
Yeah. So above this number, you will start medicating patients or not? Because I know like this topic is so controversial, and
Sure,
like when we need to like navigate the lifestyle and when we need to start medicating patient.
sure. I think generally in my practice, what I do is first of all, they ask them to do a lifestyle change if there's a room to change the lifestyle. Say, for example, if the person looks very healthy and does not have any other disease or comorbidities that we call, and then there will not be much to change in him. But if we find that he's not eating healthy, he's obese, and there's room for improvement in his lifestyle, then yes, certainly we must work more on the lifestyle change, say regular exercise and having a good control on the diet. And by and large, if the patients are obese, and that's one of the risk factors why patients may have high blood pressure, then certainly we have to work on weight reduction. And I've seen in my practice if somebody can reduce weight, and here when I say about reduction of weight, it's not 1 or 2 kilograms. I mean, they have got to lose like sometimes 10 kilograms, 15 kilograms, even 20 kilograms to make a difference in their blood pressure.
Okay, and while they're losing weight, for example, um, if a person come like in their 50 and they're overweight, and like definitely there are so much places to change the lifestyle, like they're not exercising or they have like they're overweight. So in this process to adjust a healthy lifestyle, would you recommend to also they take medication, or first like it's just go and focus on your lifestyle and then come back and we will see if you need a prescription or not? Because this is also something that I
Sure.
always was thinking about in like my practice,
Correct.
like how I should rely on a person that they would follow, really they would follow, and I will not miss the patient, for example.
Correct. No, I think that's a very good question, I would say. And now, why I say it's a very good question because, say, if I see an individual and where I feel that the lifestyle change itself, say, for example, weight reduction itself, is not going to bring about a meaningful change in his blood pressure that we are looking at. And if his blood pressure, particularly, is very high, so the lifestyle
Mm.
change is not going to work. Or if it is going to work, it's going to take a long time. And God forbid, and this patient may,
Yeah.
have some a catastrophic event or complications due to high blood pressure. So that's why here, very correctly, you suggested that these patients should be started on treatment at the same time where we advocate lifestyle change as well.
Okay, and when they start the medication, like it's a lifetime, right? Because a lot of patients they think that they might at some point cut the medication and will stop. So I wanted to see like your opinion on that. They need to continue, is it?
Correct. Majority of them, they have to continue blood pressure tablet lifetime. And some people, they do have that wrong notion that, okay, my blood pressure is controlled, and they stop the blood pressure tablets or medication themselves, which we have
True.
to educate them that please do not do that. Your blood pressure is normal. Just because you're taking
Because of the
medication, your blood
medication.
pressure is
So
controlled. Exactly,
yeah.
exactly. But in my
So
practice, again, it is very rare to reverse blood pressure, unlike diabetes. And I've seen
mm,
patients who have lost a lot of weight and they have come off the blood pressure medication. But again, I've also seen if they gain weight, blood pressure again goes up and
wow.
they've got to go on medication. Exactly.
Okay, so they shouldn't stop it themselves.
Shouldn't stop. Yes, that's the
So,
message I want to pass on. Please do not
okay.
stop your medication
Do not stop
unless
your
you've been advised to.
medications here.
Correct, correct. If your blood pressure is controlled,
Okay.
continue. Do not stop it.
Okay.
Always,
And
always seek your doctor's advice. Yeah,
no, because I could see like even like with my family and
yeah,
everything, like they all think that they can start the medication themselves in not in
Yeah.
even in the blood pressure, in all the diseases now with AI and everything, everyone think that they are the
Yeah.
doctor themselves
Correct.
and they can like start a medication and stop it whenever they
Yeah.
want or whenever they are feeling good, which is not
Yeah.
the case. If it was like, there wouldn't be a good doctor, right?
Yeah, no. See, that is the problem because now there's free advice available everywhere. If you go on the internet,
Yeah,
particularly in on social media, there are a lot of things. A lot of these are advocated, and they would say, they may promote a lot of alternative medicine, alternative therapies, and many of the information what I find sometimes they are misleading. So you have
yeah,
to be very careful. And if you have high blood pressure, and then
that's
certainly you
true.
have to first of all see the right personnel, get the advice from the proper person, and certainly it should be a doctor, and then follow the advice and take the medication. And please, please, if you are on medication, then do not stop on your own.
Exactly.
Yeah,
Exactly. Like completely agree with you with all the social media and the information is out there. So
yeah,
myself, I'm a big fan of like functional medicine or like going to the root causes of all the problems, lifestyle change and everything. But at the same time, there are some medical conditions that needs to be targeted by medication. And if
yeah.
they like stop it themselves, it can be very dangerous for them. And all the cardiac problems, it can be like it can take your life. So it's just
Sure,
better not to risk it. And it's good
definitely.
to like educate like people that it's not the case. And if you're feeling good or if the number is normal, it doesn't mean that you need to stop.
Exactly, exactly. But let me just mention one more thing here, since you raised the question where the blood pressure can be reversed or not. Now,
Hmm.
as we know, there are two types of blood pressure. There's primary blood pressure or hypertension, I would call primary hypertension, and secondary hypertension. So, secondary hypertension means that there is an underlying cause why the blood pressure is elevated, and this happens in younger individuals. Say, if I see a patient in their teens and or even in the early 20s, so what I do is I investigate these patients very thoroughly because we need to find out that if there is underlying cause, maybe hormonal cause,
Yeah.
an endocrine cause, and there are a few other causes that can actually lead to high blood pressure, sometimes in the kidneys, and there are adrenal glands, as you know, these are glands above the kidneys. So they secrete excess of hormones, and then there are sometimes problem with the arteries, which we call coarctation of aorta, and so on and so
Hmm.
forth. So there's a list of causes that can lead to hypertension, and
Yeah.
these are sometimes missed, but again these are not difficult to diagnose because these will be young individuals, and from the beginning the blood pressure will be very high, and the usual medications will not work very easily. So this gives some type of clue that this is a secondary hypertension where you must investigate, find the cause for the hypertension, and treat it accordingly. And then you may actually reverse the blood pressure. You may treat it if the underlying or root cause has been identified and treated adequately.
And like when a person should feel like a symptoms, what symptoms they need to feel that they understand they need to go to emergency room about like regarding to hypertension, like what symptoms I should feel myself as someone that no, I don't have any information that I know that I need to go either to the emergency room or go to a doctor.
Yeah, I think that's again a very, very important question. Say, majority of the patients, they will not have any symptom. And that's why I said in the beginning that it is called a silent disease and can lead to catastrophic events and including death. And that's why it is also called a silent killer. But if the blood pressure is very high, then yes, it can give you certain symptoms. One of them may be headache, which is very common, some dizziness, some chest heaviness, difficulty in breathing, palpitation. So these are the symptoms you may experience. Sometimes there may not be any symptoms, majority. So that's why it is important and vital to get someone's blood pressure checked from time to time. Now, I see again in my practice very commonly that patients will come with a headache. and they say I checked my blood pressure. I thought my blood pressure is high, and it is high. Now, it is again important to understand that your blood pressure is high because you have a headache. Yeah. So if there's any discomfort, then blood pressure will go up. So you're checking your blood pressure at the wrong time. Any discomfort, any pain will raise your blood pressure. And many physicians may actually wrongly treat those patients by giving a blood pressure tablet, and which will be not the appropriate thing to do. So it is important that identify the cause of the headache first. Maybe there's another cause why somebody is having headache. Treat the headache, let the patient settle, make him more calm, and then check his blood pressure. And by and large, I see the blood pressure is usually normal when they do not have a headache. So it is just the
Yeah,
reverse. Yeah, they get the
true.
symptoms, they check blood pressure is high. But I tell the patients again that if you have symptoms, then it will mean that your blood pressure is extremely high. That can give you symptoms, definitely.
Okay, thank you. Thank you so much. So, is there anything that I didn't ask and you wanted to mention?
Yeah. So one thing is, you'll be surprised by certain numbers which I've told you what the prevalence is. But unfortunately, science has progressed, and hypertension is a very common disease, not a rare disease. We see very commonly in your clinical practice.
Right.
But what is sad about it, that still only 21% of the patients they have their blood pressure controlled. That means almost 80% of the patients do not have their blood pressure controlled, which is very sad. Despite all the research that is being done, we have got wonderful medications in the market that control the blood pressure, but large uh, proportion of the patients, they do not have their blood pressure controlled. Now you may ask why. Yes.
Yeah, you mean the ones that they are taking medication, blood pressure, 80% of them is not controlled?
Correct, correct. See,
Wow.
50% they do not know, but the 50% who know that they have got high blood pressure and they are taking medications, 80% they are not controlled. And the reason, there are few reasons. It's multifold reasons. So one is they have not been given a blood pressure tablet to start with. So the physician may say that, okay, uh, just follow lifestyle and follow lifestyle and follow lifestyle, and the blood pressure medication is never initiated. The second reason could be that they are given blood pressure tablet, but maybe not the right one that they actually require. It
Or
could be
not
that they have been given a blood
consistently.
pressure medication. Yes, it's not the right one. It's not in the correct dose. And more importantly, the patients may not be taking the medication regularly, or they may not be taking it at all. And there are a
Exactly.
few other reasons as well, but these
The
are the common ones.
compliance of the patients. Yeah.
Yes. Yeah. So it is very sad indeed that the
Yeah.
80%. Yeah.
Wow.
When
It's a
I heard
big
this for the first
statement.
time, and when I was told this, but I was a little surprised.
Me too. Yeah.
Yeah.
Like I was surprised. Okay.
Yeah.
So, what is, if you want to mention one message to the audience and everyone who are watching this video about hypertension, what would that be?
Yeah. I would say that blood pressure or hypertension is a silent disease. So get your blood pressure checked and get it checked as a routine. And also, one message I would
Do you
like
think
to,
once in a month is okay?
once in a month, yes, it's fine. Sometime it may be once in 3 months should also be fine.
Okay,
And
okay. Good.
yes, and older you are, then the frequency has to be little more. And if you are say in your 30s, then once in 6 months may even be okay. So as you grow older, then maybe yes, once in 3 months, once in 6 months.
Okay.
That should be the frequency. And one important message I will also give to the healthcare professionals, because again I see this, that if you are taking blood pressure, again it's a very very simple skill we are taught in medical school, but it is extremely important that you measure the blood pressure correctly. And
Mm.
I've seen a lot of times, even nurses, some doctors, and the figures that come from other colleagues, the blood pressure, unfortunately, it's not being measured correctly. So that is the bottom line. And if you do that, then the you're going completely in a different direction. Either you do not treat the blood pressure or hypertension, or you overtreat it. You get my point? So it is
Yeah.
important that measure the blood pressure correctly and diagnose the hypertension from the very beginning before you start a management plan for that patient.
Okay. Thank you. Thank you so much.
Awesome.
And like I really enjoyed our conversation, and it was so informative. I hope people also get the point and get the blood pressure checked
True,
regularly.
true, true.
And thank you so much for your time, and hope to see
Thank
you
you.
soon, guys. Thank you
Thank
for
you. Thank
watching,
you, Dr.
and
Golsa.
don't
Thank you.
forget to like and subscribe and send this to everyone that you love in your life, because you want them to be healthy.
Thank you so much. Thank you.
Thank you. Bye bye.
Thank you. Thank you. Bye bye. Bye bye. Thank you.